Today's video topic is home births. Home births have been a growing trend over the past few years as more and more women seek out this option as an alternative to a hospital birth. This increase in demand is likely due to the COVID-19 pandemic. Many women are afraid that their newborn child will contract the virus and possibly die. Another cause is the increased interest in natural childbirth and the desire to have more control and autonomy over the birthing experience. Additionally, home births can be much more affordable than hospital births, as they typically require no medical intervention. Benefits of home births. A home birth may offer some significant benefits, such as more control over the birthing experience and an opportunity to create an intimate, private, and personalized birth experience. The pregnant woman also will have the support of family and friends, and also you will ensure that your baby is surrounded by familiar people and smells from the very beginning. Home births can also be less expensive and less stressful than a hospital birth. For example, there are no additional costs associated with a hospital birth, and the mother may be able to rest in her own home and avoid the worry of being in a hospital environment. Additionally, some women may prefer the convenience of having their midwife come to their home rather than having to travel to a hospital or birthing center. Risks of home births. Of course, a home birth isn't without risk. The most significant risk is the potential for an emergency, such as a prolapsed umbilical cord or other complications. So, if something goes wrong, you may be far away from the nearest hospital or medical facility, and even if you can reach one quickly, you may not have access to the specialized care that may be necessary. Another potential risk is the potential for infection, which is a major concern in any birth setting. Additionally, some studies have found that home births may also be associated with an increased risk of postpartum hemorrhage and even perinatal death. Finally, there is a greater risk of harm to the baby due to the lack of medical intervention and monitoring. So, it's very important to take the time to understand and weigh the risks, benefits, and other factors associated with a home birth before making a decision. It's also important to talk to your midwife or doctor about the risks and benefits of a home birth, and to make sure you have a plan in place in case of an emergency. Ultimately, it's up to the mother to decide if a home birth is the right choice for her and her baby.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.